My name is Melanie, and I'm a nurse practitioner student, and I will be doing an assessment. I just cleaned my hands as soon as I walked into the room. My MA has got the vitals, the weight, height, hearing tests, which check cranial nerve number 8. And I'll be assessing cognition, behavior, dress, and their orientation. So what brings you in today, it's a wellness exam. So I'm examining the face. It is symmetric, pink, no lesions or abnormal nevus. Palpating the masseter muscles here. Can you clench your teeth for me? And move your jaw side to side. Okay, cranial nerve number 5 is intact. Can you raise your eyebrows and puff out your cheeks? Can you smile? Cranial nerve number 7 is intact. I am assessing the hair. It's clean. I don't see any infestations. Palpating the scalp, I don't feel any nodules. Okay, looking at the eyelashes. They're curling up on top, down on the bottom. You feel any tenderness here?
No.
Okay. I'm going to pull your eyes down. The conjunctiva are pink and moist. Okay. If you will just look straight over my shoulder and then focus on my pen. So accommodation is intact. I'm going to look at your pupils here. So I'm looking at direct and consensual constriction. So pupils are equal round reacted to light and accommodation. And corneal light reflex is intact. If you can follow my pen here. So EOMs are intact. That checks cranial nerve 3, 4, and 6. If you can just look straight over my shoulder and cover one eye. And then switch, cover the other. I'm making sure your eyes aren't wandering. Okay, I'm going to take a look in your eye here. Okay, so I do see the red reflex. And as I get closer, I do see the retinal background is even, no hemorrhages, the sharp optic disc. Okay. Again, retinal background is even, no hemorrhages, and a sharp optic disc. Okay, moving on to the ears. Assessing the skin, I don't see any abnormal nevus, lesions. The ears are lined up with the outer canthus of the eye. I'm going to pull on your ear here and press on the tragus. Do you have any tenderness there? Okay. Alright. Going to take a look in your ear. Assessing the canals first. They are clear, no redness, drainage. I do see the tympanic membrane. It is a pearly gray. Cone of light is at 5 o'clock. All landmarks are intact. Okay. Switching sides. Again, the canals are clear. Tympanic membrane is a pearly gray. Cone of light is at 7 o'clock. All landmarks are intact. And cranial nerve number 8 was checked when the MA checked the hearing test. That's cranial nerve number 8. Moving on to the nose. Assessing the skin, there are no abnormal nevus, no lesions. It is symmetric. Palpating the bridge, any tenderness?
No.
Okay. Checking the frontal and maxillary, ethmoid, sinuses, any tenderness?
No.
Okay. Can you close one nair? Close one side of your nose. Breathe in and switch. So nairs are patent. Have you had any trouble smelling or tasting?
Nope.
So if he did, we'd be checking cranial nerve number 1 by closing the eyes, occluding one nair, and smelling scents such as vanilla or coffee. All right, I'm going to take a look inside your nose here. So the nasal mucosa is pink along with the turbinates. And again, pink and moist, turbinates, nasal mucosa, and I don't see any septal deviation. Okay, moving on to the mouth. The lips are pink and symmetric. They move symmetrically. Can you open your mouth for me? The buccal mucosa, pharyngeal wall, the gums, they're all pink and moist. The tongue and the tonsils have no exudate. Tonsils are +1. The teeth are all intact. Good dentition. The hard palate is intact, as well as the soft palate, all pink and moist. Okay. Can you stick out your tongue for me? The tongue is midline. Can you say light, tight, dynamite?
Light, tight, dynamite.
So that's cranial nerve number 12. It's intact. And can you say ah? And I would do the gag reflex with a tongue blade. That's cranial nerve 9 and 10. Okay, moving on to the neck. I don't see any lesions, any abnormal nevus. The trachea is midline. We'll do some range of motion. Can you touch your chin to your chest? Look up to the ceiling. Look left and right. Just roll your neck around. And then touch your shoulders to your ear. So full range of motion of the neck. I'm gonna look at your lymph nodes. So we have pre-auricular, posterior auricular, occipital. We have tonsillar, submandibular, submental. We have posterior cervical. We've got our superficial cervical, posterior cervical, deep cervical chain, and supraclavicular. Any tenderness?
Nope.
Okay, they're non-palpable. I am looking here for jugular venous distension. I don't see any. And I'm palpating carotids. They are 2+. Okay. And with my bell, assessing for bruise. Okay, no bruise. I'd like to palpate your thyroid. If you can swallow for me. Okay, no nodules. Can you lift your shoulders for me? And can you look left and look right? Cranial nerve number 11 is intact. Okay, for the upper extremities, I'm looking at the clavicles, the shoulders, and the scapula. They all look symmetric. Palpating the shoulders, chromium process, elbows and wrists. Any tenderness?
Nope.
I'm not feeling any nodules. Okay. We're going to do some range of motion, if you don't mind standing up for me. So for the shoulders, if you can just lift your arms straight up over your head, let them swing behind you. Just watch that chair. Arms go out and over your head. And we're going to cross our arms in front of us. And the other. For the elbows, if you can just bend your elbows, straighten them out. We're going to flip our palms over and flip them over again. Great. Okay. With palms down, if you can just point your toes to the floor, fingers to the floor, fingers to the ceiling. straighten them out. We're going to move our fingers towards the midline and move them out. Okay, can you ball your fists up for me? Straighten them out. Okay, we have full range of motion of the shoulders, elbows, wrists, and hands. Okay. Looking at the hands, I don't see any lesions or abnormal nevus. While I'm palpating, I'm not feeling any nodules. Okay, can you grip my hands? Okay, they are equal. Fingernails, I'm seeing capillary refill is less than 3, and I don't see any cyanosis, any clubbing. They are pink. The radial pulses are 2+, and the brachial pulses are 2+. If you want to sit for me, I'm going to check your reflexes. You just relax this arm for me. And down the bicep. And I'm going to hold your thumbs here. If you can just relax those arms. And just relax this arm. Okay, and then tricep. Okay, so deep tendon reflexes are 2+ and equal. Okay, we'll move on to the back. If you can just face the wall for me. So looking at the back, I don't see any lesions or abnormal nevus. The back is symmetric. The AP is less than the transverse diameter. If you can take a deep breath for me. The lungs expand symmetrically. I am going to go ahead and percuss. Percussion reveals resonant sounds. Okay, if you can say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99.
So for tactile fremitus, the vibrations lessen as you progress down. So for vocal fremitus, if you can say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99.
So the sounds are muffled and indistinct. Okay, if you can just take a deep breath for me. So vesicular breath sounds in all lung fields. Okay, if I can look at your chest. So looking at the skin of the chest, I don't see any abnormal nevus. I am looking for the PMI. It is usually left mid-clavicular line, about 5th intercostal space down. I do not see it. I'd like to go ahead and percuss. Percussion reveals resonance. Let's go ahead and listen to your lungs. Just take a deep breath on. vestibular breath sounds in all lung fields. Okay, using the diaphragm, I'm going to listen to your heart here. Just relax. And listening with my bell. Okay, if you can lay down for me. I'm going to listen to 8 to man again, starting with my diaphragm. And switching to my bell. So no S2, S3, or murmurs. And I'm palpating the apical pulse, and again, it's usually left mid-clavicular line, 5th intercostal space down. Okay, moving on down to the abdomen, assessing the skin. I don't see any lesions, abnormal nevus. The abdomen is symmetric. It is flat. I'm going to go ahead and listen to the bowel sounds. So bowel sounds are present. Switching to the bell and listening to the aortic artery, the aorta, the renal artery. Iliac. Femoral. No bruits. I'd like to percuss on your abdomen. I do hear timpani throughout. Percussing for the liver. We're going to percuss down until we hear dullness. And then we'll leave a mark. Then we're going to percuss up until we hear dullness. And we would leave a mark. So no hepatomegaly. To palpate, we're going to wrap our fingers around the ribs. Can you breathe in for me? And relax. Any tenderness? Okay. To percuss the spleen, mid-axillary line, we're going to percuss down. And I hear timpani all the way through. So no splenomegaly. And to palpate the spleen, any tenderness? Okay. Okay, moving on to light palpation. Any tenderness? And moderate palpation. Okay, we will find McBurney's point and do rebound tenderness. Tenderness. And we'll check again. Okay, and palpating the kidneys. Tenderness. Tenderness here. Okay, moving on to the hips. Any tenderness here? Okay. Passive range of motion. We'll move your leg here. Just let me know if you have any tenderness. Okay, we'll do this one the same. Any tenderness? Okay, full range of motion of the hips. If I can have you sit here again and face the camera. So I'm looking at the lower extremities, the skin of the legs, the knees, ankles, feet, looking for abnormal nevus or lesions, palpating all the way down, ankles. I did the knees. Any tenderness?
Nope.
Okay, I don't feel any nodules. For range of motion, just be careful. Can you straighten your legs out for me? Bend them down. If you can have your legs crossed in front of you and swing your legs out. Okay. For your feet, if you can press your feet like you're pushing a gas pedal, flex them back. Roll the bottom towards the center and then roll the bottom of them out. Full range of motion of the knees, ankles, and feet. I like to do the deep tendon reflexes. Just watch your leg here. And that was the patellar. Now we're doing the Achilles. And the Babinski. Okay, no Babinski. All right, moving on to neuro. So I have been assessing the cognition, behavior, the appropriate dress. He is alert and oriented. If you can do the heel and shin, so take your heel, we'll do shin test. Okay, to assess superficial pain, we would take a tongue blade and break it into a sharp and a dull edge, touching the skin various places, having the patient identify if it's a sharp or dull sensation. The temperature would be tested by using a test tube with hot water and cold water, and touching the body in various places using the hot or the cold, having them identify which temperature. Stereognosis is the patient identifying different objects such as a coin or a paperclip in their hand. Graphesthesia is me writing a number in their palm of their hand and having them identify what number. The 2-point discrimination is two edges of the paperclip touching the pad of the finger in two different places and getting closer and identifying at what distance they can no longer feel two sensations. Extinction is touching their body either on one side of their body or two and having them identify if they felt one sensation or two. Position sense is moving either their finger or the great toe up and down and the patient identifying which direction you moved their finger. And vibratory is checked by using a tuning fork and striking the tuning fork and placing it on a bony prominence. And the patient should identify when the vibration started and when it ended. Okay, I would like for you to walk for me. You can stand up and walk. And we're just going to walk back here. So we have proper posture, normal gait. If you can walk on your toes, walk on your heels. So able to walk heels and toes. And then we're going to walk right in front, heels to toes. Okay. I am noting no pronation during his ambulation. So we're going to do the Romberg test. If you can put your arms out in front of you, close your eyes. We're checking your balance. Okay, you can open your eyes. Romberg is negative. Okay, if you can turn around for me. I am assessing your spine. It looks straight. The back is symmetric. You have appropriate posture. If you can, well, Do you have any tenderness here?
No.
And palpating the paravertebral muscles. Okay, go ahead and put your arms over your head and lean forward like you're diving. Okay, any tenderness here?
No.
Okay, you can come up. And can you bend backwards for me? Great. And to the left and to the right. Okay, thank you. Full range of motion of the spine.